And with that, we'll go ahead and get started. So today we will be joined by Shannon Glenn, Executive Director for My Pitbull is Family, who will be presenting Mutual Aid in Action, supporting people and pets in times of uncertainty. So, Shannon has been shaking up the animal welfare world since 2014 when she first joined My Pitbull is Family, quickly becoming a go-to expert in housing policy and surrender prevention. With deep experience in grassroots campaigns, voter outreach, community building, fundraising, homeless advocacy, and policy creation, Shannon is a relentless advocate for people and pets alike. She has championed the rights of adults experiencing homelessness as the former shelter supervisor of Minnesota's only pet-inclusive emergency homeless shelter. So it truly is my pleasure to welcome Shannon today. We have a lot of content to get through this morning, so Shannon, please take it away.
Thank you so much for having me. I am so excited to be here, and I can not wait to chat about the work that we're doing here in Minneapolis, and hopefully it can relate to some of the work that you are doing as well. There we go. I'm Shannon. All of the work that we do started with my dog, Wilbur. He is this little brown and white dog in the corner. And yes, that is me with pink hair in my early 20s. We have aged gracefully into our late 30s at this point with the organization. But as Danielle mentioned, I am the executive director of My Pitbull is Family and have been around in human services most of my professional career. So it's nice being among, both animal welfare advocates and, of course, those that are really focused on supporting humans during their times of need. So thank you all for taking time out of your day to be here with us. So first, I want to chat a little bit about mutual aid. It's a hot topic, especially, as we are dealing with various occupations across the country, and mutual aid, those two words continue to pop up. So I want to chat. It is about solidarity. It's not charity. So resources are shared unconditionally. So that means that there's no vetting, there's no background checks, and there's not really a power imbalance between those that are providing services and those that are receiving services. It's pretty horizontal. Groups really reject hierarchies. So there's no specific leaders within mutual aid. There are people who help organize and help direct, but really it is a horizontal, group of people who are making decisions collaboratively. There's a shared understanding between participants that are utilizing the services and those that are providing it, that we recognize that there are systematic gaps and economic barriers. It's not personal failures that cause the hardships, which those of you that are working in various homeless shelters and, of course, in animal welfare, hardships can be really tough and they impact people really strongly. There's also the fact that it's action oriented. It's focused on immediate survival and what material supports can be provided to the community. And ideally, it's a long-term support to make sure that the community can continue to be resilient, regardless of what is happening in the community. So what is mutual aid not? I think this is really, really important, especially as, things are happening around the country and we're all trying to get involved and trying to support our community in the best ways that we can. So mutual aid is not a one-way street. It's not some wealthy donor or an organization that's just handing things down to someone who is just taking. Instead, it's a shared system that's built on solidarity. And it's not about pity. It's not about looking down on anyone. It's truly a relationship between those that are organizing services and those that are receiving services. And oftentimes it's very similar. It's the same person who is providing that service and receiving. It's not government welfare. It's not a state-run program. The government typically isn't involved. It's not a safety net that the government's providing. It's completely outside of government funding, control, police, or state oversight. It is truly community-focused and community-driven. It's not relying on a board of directors or some corporate boss or rich founders. And it's definitely not making sure that we are deciding who is deserving of that support from above. So there's not some person sitting at a desk saying, people can only receive these services if XYZ are met, or if their need is this great. It also means that there's not means testing. And I know this can be really difficult, especially when it comes to programming. But mutual aid never requires people to prove their need. There's no invasive paperwork. They don't have to justify their hardship, which is not like many social services. Social services often have, you have to meet a certain income, or you have to live in a certain zip code. And this doesn't mean that you can't design programming for a specific area of your community, but this just means like not making people prove their need to you, which creates a really interesting power dynamic if that is something that you do. It's not some savior complex or white savior complex. We talk about that a lot in community work. It's not about making you feel good as the person who's doing the work or who's volunteering to do the work. Everyone in community, whether receiving, providing, both, you have a shared need and an equal worth. And that is really, really critical to mutual aid. It's also not a business transaction. It's not a direct purchase. It's not, a back and forth kind of trade. It's literally just providing without questions. And this is a really big one. And we saw this happen a lot here in Minneapolis with Operation Metro Surge. And I'm sure you've seen it in community as well. Mutual aid and doing this work is not a PR stunt. It is not to make your organization or your business look better. It's not to recruit. It is literally like you are doing the work because you want to, not because it's going to get you clicks on social media or news stories. And so being really, really mindful of how we tell the stories of mutual aid and the work that we're doing is important. But we want to make sure that it's not at the sake of those that are receiving support. So 2 of my favorite books on mutual aid, feel free to screenshot this or you'll get these slides later. But Dean Spade's Mutual Aid book, it's a really quick read, like read it on a flight to a conference. It's fantastic. And then Rules for Radicals. It is more of a radical book, but if you haven't read it, I would encourage it as well. And there's so many other amazing books about the work that all of us are doing. But these are the 2 that I love that are focused on mutual aid. So a little bit about My Pit Bull is Family and the programs that we offer. The list is long, and we've been around since 2011, so programming is always growing and changing. We started by focusing on dog-inclusive housing. We have our North Minneapolis Pet Resource Center, our Community Pals program, our monthly vaccine clinics, our spay-neuter programming, our Mobile Pet Resource Center and community outreach, our camp program where we train community members to become vet assistants. We have a thrift store. At the end of the month, we are purchasing a for-profit urgent care and bringing it onto our nonprofit portfolio. And we have our Northside People's Pantry, which we'll chat more about today too. Now, all of these programs do not have income or residency restrictions. However, there are programs around the country that do, that either align with mutual aid or are very similar to that work. So thinking about organizations that have a pet food pantry or maybe a human pantry, they require a government-issued photo ID. You have to prove your need. You have to prove that you have spayed or neutered one of your pets. There has to be a conversation listed with the veterinarian on the pet's documentation before even providing a bag of food. So you're saying that you have someone who's showing up to your organization and they cannot feed their pets. They are completely out of food. You have to have a conversation with whatever veterinarian that they last saw before they can provide food, which is just bonkers to me, and I will never understand that one. You must have had your pets for at least 6 months to be eligible for programming. Here at the Pet Resource Center, I can say almost every shift, there's someone who is like, I found this dog, or someone left a dog with me, or someone had to move, or they had to go into treatment. You all know these stories. So having a pet for 6 months just to be eligible for programming isn't feasible for most people. And then, of course, owner surrender fees. There are organizations around the country that require people to pay a fee, even just to announce that they need to surrender their pet. That doesn't mean that the organization's actually going to accept their pet. It's literally you fill out the form, you pay the fee, and maybe, just maybe, they'll accept your pet. So these are just a few of the restrictions that I've seen from organizations within the animal welfare field. And so it's really hard to think about, like, how do I as a decision maker define need and determine what need is enough? And that's just interesting. So this is a little list, just thinking about, what impacts humans, what impacts animals, or both. If we were in person, I would make you like raise your hands and it would be a whole little exercise. But just quickly through the list, a lack of affordable dog inclusive housing, that doesn't just impact humans, it impacts animals as well. So that's both. Lack of public transit, both. Job loss, both. An unexpected hospital stay. If you're providing crisis fostering, that this is impacting both. Loss of health insurance, a car accident, cuts to public programming, example, food support, which we are all going through right now with SNAP cuts. Someone experiencing a mental health crisis, experiencing domestic violence, and even something like a low credit score is going to impact both ends of the leash. And so it's really important to remember that. And I know a lot of you are doing this work and you are working with families and individuals who are experiencing a lot of these. And they may or may not have pets, but it's impacting both ends of the leash for sure. So it's not a secret that we as animal welfare, as human welfare, we have a lot of work to do. We have a lot of double standards within our work. One that I am pretty passionate about, and this might ruffle some feathers, is the double standard that we have for encouraging community members, specifically low-income community members, to go through with a spay abort. But then we have rescues that do maternity shoots and have higher adoption fees for pets that are born within their organization. We also have really restrictive adoption policies. We have racist and classist policies, and we don't do the best at reacting to community need. In animal welfare, people tend to stay with the status quo. But when we're talking about mutual aid, you have to be willing to adapt to community needs, and that is really, really important. Now, these are just some of the other different barriers that have been put in place for people to receive services from Human Animal Support Services, or HAAS, mandatory background checks, landlord or HOA reference checks. Let's see, there's some that were really, really interesting. High adoption fees, operating only during standard business hours, that's a really big one. Requiring meet and greets, and unwelcoming staff, mandatory waiting periods. So like all of these are barriers to people receiving services. So just as we're thinking about providing mutual aid services within our communities, like none of this should exist. Now, I know that this work is hard, and every day as leaders and community advocates, we're making decisions that impact the lives of people in our communities and their pets. And community needs can change in an instant. And it's really important for our organizations to step up in these moments, which is exactly what mutual aid is. Now, whether you like it or not, pets are political, and there's no human welfare or animal welfare without human welfare, right? They go hand in hand. There are no pets without people, which is a saying that I say all of the time. We often fixate on the pet aspect, but we forget about the people. But we really need to focus on the people, and then the pets are the bonus. Now, we're going to talk a little bit about things in Minneapolis. I know that in your areas, you're also experiencing hardship and various crises, but Minneapolis has been a national center of attention for various reasons that aren't super great. So as we talk about how My Pit Bull's family has shown up in mutual aid spaces, we're going to talk about the murder of George Floyd that happened in 2020. So our neighborhood, we're based in North Minneapolis. So the murder of George Floyd happened in South Minneapolis, but we are in North, and so it rippled throughout the whole city and, of course, across the country. Our neighborhood in North Minneapolis lost access to all of our grocery stores, our social services, and of course, this was all happening during COVID. So families were already struggling with COVID, and then we add losing all of our resources on top of it. So for 14 days, we turned our North Minneapolis Pet Resource Center into a community hub. And now this wasn't, oh, Shannon is leading everything. As you can see in the picture with all of the grocery bags, that was our back parking lot. So every bag represents a donor, someone we never met, someone maybe that would stick around and volunteer with us, a community member who wanted to give back. They would just come and drop off supplies. Now, every person in that photo also was a volunteer. We all came together. We were making decisions alongside community members who were receiving, much needed supplies. But we provided human food, pet supplies, household items, and so much more. We also were the storage for all of the emergency supplies, so all of the fire extinguishers and flashlights and anything that was really needed to keep our community safe. And like our council members and community members had access to the building 24 hours a day, just in case something were to pop off and they needed something. We also utilized the space to dispatch medics. So those government services were not available. So EMTs, ambulances, police were not responding to calls. So as we were talking about mutual aid, we decided to come together and have medics on site at our resource center that we could dispatch at any time of day. I was there till 3 and 4 in the morning with medics just in case something was to happen. And so, all of this wouldn't have happened if the community didn't come together and really just, we provided the space and community did the work, which was really great. Now, we fast forward just 5 years. Operation Metro Surge begins in Minneapolis. We moved from that building that was in the previous photo, which was a 1,400 square foot building, into a 14,000 square foot building. And so we had the space. So December 2025 happens. December 15th, we started meeting with high school teachers, parents, and neighbors. So they realized that students from the local high school weren't going to school. They were staying home. Families were concerned, and families were shut in. They were not going to the grocery store. They weren't doing laundry. And these high school teachers, parents, and community members were like, we need to do something. Where is there space for us to do it? And of course, we're like, we've got the space if you bring the people and the resources. So just 4 days later after that meeting, we started doing deliveries for 50 high school families. It was super clunky. It wasn't perfect. And mutual aid is never perfect. We all start somewhere, and it's a learning experience for everyone involved. So after that December 19th day, we launched our North Side People's Pantry, which again was created with community. We were supporting about 100 to 200 families every week with custom grocery deliveries and pet food deliveries. And then we move into January. January was a really, really intense month here in Minneapolis. The People Over Papers map, those are all, either critical abductions, active abductions, things that people observed. And I'm sure there's a ton missing, but it didn't just impact, Minneapolis proper, but you can see it impacted the Twin Cities in total. The picture below of ICE agents at a house, I actually rolled up to this call just to see if anyone needed a ride home. This was just blocks from my house. And after all of this had happened, the family and people in the house walked out, and they were all people that utilize our pet resource center. So it's really important just to remember, like, these things are impacting people that we've known for years, and families that are already utilizing our services. Now, January through today, we had some two high profile cases with Renee and Alex. In North Minneapolis, just right over the highway from our resource center, there was a shooting um, by an ICE agent, and we could smell and taste the tear gas from our parking lot. We could hear all the bangs. Like, this is very central and local to our team and our community. And so in January, we really started to step things up. We were seeing and delivering to something like 500 families every week. In June, we were doing 300 families a week, and currently we're at 150 families every week, still receiving groceries and pet food from us. And that number is down only because of volunteer capacity and monetary donations being down. We could easily still be supporting 500 families every week through this work. And so just because you don't see the need, that doesn't mean that the need isn't there. And it's, mutual aid is what is filling those gaps, right? We have government services where these families should be able to go to a food shelf and feel comfortable with that. They should be able to get rent assistance through the county. They should be able to get all of their needs met by these safety net programs, but there's still a huge gap, and that's where mutual aid comes in, and that's where the work that we're doing applies. Another thing that happened during Operation Metro Surge and is still ongoing is focusing around vet care. So this is where it comes back to, not having guidelines or not making people prove need. So during the occupation, which yes is still ongoing, but we'll say from January to about April, any family who said they were impacted by ICE and had a vet care need, we just said yes to. And we were able to make sure that their families had the care that they needed. Whether that was Tommy the cat, who was blocked multiple times, and their family was self-deporting to Honduras, we were able to get Tommy the cat happy and healthy enough to travel with them. We also provided end-of-life care for families. We provided spay neuters and vaccines and anything that we possibly could for these families that weren't able to leave their homes. And of course, we did that in partnership with Access Veterinary Care. We also partnered with Pet Taxi Cab. They're a really fantastic business here that was going to homes, picking up the pets and bringing them to us. We also had a really amazing group of volunteers and, of course, students. Again, this was you put the call out and everyone just shows up and does their part and does what they can in order to support families. And that is exactly what mutual aid is. So mutual aid is so important because we have so many reasons of why pets and people are separated across the country. The stats are astounding of the number of pets that are owned throughout the country. So something like 79 million cats, 108 million dogs. And those numbers are only increasing where once people are stably housed or feel that they're ready to have a pet, they're making that happen. And we're seeing, 17% increase in households with cats over the past 10 years, almost 50% with dogs in the last 10 years. And again, those numbers are only growing. So animals aren't surrendered all of the time because of issues with animals. It's often human end, like housing or financial reasons or caretaker death, right? So there are reasons of why we need to be showing up in different ways in the community to make sure that people have what they need, make sure that we create those safety net programs for people. And oftentimes those are mutual aid related. There's also Haas again. They provided a really great owner surrender reason. I think being able to look at this list and create programming around it is really important. Yes, we can't necessarily create programming around someone having a new baby, right? But we can have conversations about it ahead of time. But the biggest thing for those of you on the call that are working in animal welfare is being really understanding, right? Some of these things happen in an instant. Some of these things can be planned, but some of them aren't. And we just need to be more open and willing to have those conversations and create programming to help support, you know, and help prevent some of these surrender reasons. Another piece is housing, right? Those of you that are working in human welfare, you know that housing, there's an affordable housing crisis. I don't know if we'll ever get out of it. If I hear one more time that an encampment is getting cleaned up and there are plenty of shelter beds for people to go to, we all know that is a lie. And so making sure that people have housing, it is care. So making sure, if you're doing mutual aid, are you providing rent assistance? Are you putting up barriers so people or for people to get that rent assistance, or are you just meeting people where they're at, right? So none of that, oh, well, do they really need it? Or they're just going to go spend it on something else, or like those conversations just have to stop if you're going to be doing mutual aid work. So when we talk about housing and doing mutual aid and providing rent, there's over 5 million households behind on rent. And I would guarantee that number is much greater now with all of the occupations that have happened, which means that over 7 million pets could be at risk of eviction. So that is, again, why we have to be showing up in different spaces, why it is so important that, Red Rover exists, why my dog is my home exists, right? Like it is so important that organizations are straddling both animal welfare and human welfare, because if we're not talking about these things, if we're not talking about 5 million households behind on rent and at risk of eviction and how that's going to impact our shelters, both human and pet, we're doing a disservice to the communities that we're working in. Now, I mentioned that my pit bull's family does a lot of housing work as well. Less than 9% of rentals across the country are pet friendly, or pet friendly rentals are dog inclusive. So when we say dog inclusive, we mean no breed or weight restrictions. But we also know housing is the top reason why dogs are surrendered across the country. And housing is expensive. It's only getting more expensive. There are tons of barriers in order for people to access housing. Plus, then you have all these pet fees, right? So there's the averages are listed there. It is expensive to live in the US with a pet if you're a renter. It's expensive to live in the US, period. We know this. But having pets is a whole different level or whole different layer to the inaccessibility of housing across the country. Now, vet care. We know that providing vet care, whether it be through mutual aid or through our programming, is just so critical to keep people and pets together. According to a study that PetSmart did around veterinary care across America, 52% of American parents said that they skipped necessary veterinary care in the last year just because they couldn't afford it. 71% of pet parents say that they skip care because they can't afford it or they didn't think it was worth the cost. I mean, that is a pretty large percentage of pet parents across the US, or at least the ones that were surveyed. But I think it would be about that if we looked across the country and surveyed every pet parent, right? Vet care is expensive. It can be unpredictable. You never know when an emergency is going to happen. And so we have to remember, again, like how do we make sure we create programming to help offset some of this for the families that we work with. We did a survey here in North Minneapolis. We are part of the PetSmart Incubator program. Frankly, people just say the cost of services are too high. Whether that is they're getting services with us or they're getting services out in the community. A lot of people forget that we provide veterinary services until they get really used to us and they start coming to us all the time. But the clinics in and around North Minneapolis are frankly not affordable. And of course, everyone has their own definition of what affordable is to them. but I think we can all be in agreement that the cost of vet care is high. And as someone who is about to have our own vet clinic, we understand why those prices can be high. But we're still going to do our best to make sure that vet care can be as affordable as possible for everyone. People think that it's really important to keep their pets healthy. So when we're thinking about building out mutual aid type programming, having conversations about, what is a low cost service? How do we do more outreach? Do we offer payment plans? Do we do pop-up clinics? How do we make things more accessible? Right? So that's removing those barriers. That's is the clinic that you're working on the bus line? Are the hours available for people to be there? What else can we be doing to make sure that people have access to what they need? And if you are doing mutual aid work, I promise you that you do not have to sit alone in a silo and come up with what those answers are. Because when you're doing mutual aid work, you're going to be working in and with community. And community is really the decision maker of what happens. And that is where the magic happens, right? So it's not Shannon sitting at a table saying, oh, it'd be really great to have a pet resource center or to open a clinic. It's years of trust and community building and taking that feedback and being like, okay, here's how we can do it, but constantly getting that feedback from the community of what we can be doing better, what is needed, and especially in times of urgent need, figuring out how we can adapt to support those who need it most. I promise everything is fine. This is probably how we're all feeling these days of the dog in the house with all of the flames. We will get through this. It will just take a lot of patience and, again, community building, because don't do this work alone. Now, I want to talk a little bit about some of the things that I've seen organizations say. So we've talked about how mutual aid is, really working in and with community, that it's not having barriers, it's not a PR stunt. And so when organizations talk about the work that they're doing, or oftentimes shame those who maybe need services, there needs to be some change around that. And so, explicit language warning, we are going to swear here a little bit. But everything that is post this slide are things that I've seen on social media from organizations who say that they do community work or that they're doing mutual aid type work. And I bet in the chat you can write how you feel. Maybe if you were the person that this organization is talking about, how that would make you feel. And I guarantee it's not good. So if you abandon your dog, you're an asshole. If you put your dog in a shelter where a large number of dogs are euthanized due to lack of space solely because you're moving, you're also an a-hole. Now, we just went through and talked about why finding housing with your pet is so hard. Also, we just need to stop shaming shelters for making really, really hard decisions based on the community need, right? So, having conversations around no kill versus kill shelters, right? We just need to stop even calling things kill shelters. Like, shelters are having a really, really hard time right now because the community is having a really hard time right now. So it goes hand in hand. If you can't afford a pet, don't have one. Charlotte, one of my pit bulls, just had a mask removed 2 weeks ago. There was no way that I could afford to pay for it. And thankfully, the clinic that I went to had a fund to help make that happen. But that doesn't make me a bad pet parent just because I wasn't able to afford, a mass removal that was impacting her quality of life. Horrible people, pray they never get another animal. Now, I hope these two potatoes make you smile a little bit while we're talking about this. This was such a fun photo shoot that we did. And I should say all of these photos are actual community members that either, have come to us for support in various ways, whether it's pet food or vet care. But they also give back and volunteer with us. They are part of our team. They're part of our family without that being the toxic, our work is a family. But truly, our community members feel like family, and that is the crux of mutual aid as well. Shitty humans should never have dogs, cats, children, or any other dependents. Um, Again, these are real things that I've seen organizations post on their social media. And if I was someone who was seeking support and I saw your organization say this, I I don't know what I would do. Or if maybe I surrendered my pet to you and then you post this shitty humans post, like that isn't going to make me feel good about the decision that I just made. And I was already feeling pretty crummy about having to make that life decision for my family and my pet. I would rather be homeless before I would dump my dogs anywhere, let alone a high kill shelter. Now, I bet everyone who works in homeless services, the hair stood up on your neck. You probably clenched your fist because I do that every time I see this. I have worked in human services and homeless services for a very long time. When I give presentations like this in person, we do a little survey of like heads up, 7 up almost. And I'll ask, has anyone in the room experienced homelessness before? However, you want to define that. And oftentimes there's 1 to 3 people in the room that have. And so then we have a conversation as a large group without pinpointing those who have experienced homelessness, but we have a conversation around, you know, being experiencing homelessness isn't some luxury. No one wants to experience that. And if people had the choice, I guarantee they wouldn't choose that. And it's really important that we remember that there are people that we work with. There are people probably on this call who have experienced homelessness before. And so when we see things like this, you can only feel the privilege that comes out of a quote like this. And it's frankly not okay. So again, we have work to do as our fields. Don't be a dick, keep your dog. Oh, this one. It was just interesting seeing this on a shelter page. But is it National Surrender Your Pet Day or what? So it should be many. So many messages today about rehoming animals. I can't take it anymore. For everyone who wants to rehome their pet and have the audacity to tell me their name that you had me pick out. Effing BS. I mean, these are professionals in our field posting these things on organizational pages simply because people have reached out to them for help. And so clearly we have work to do in communities, but also on ourselves and internally. So we have to stop sharing this meme. I know people are sharing it all over the time. So I'm moving, I need to rehome my dog, find a place that you can take your dog with you. I don't know about where y'all are, but our homeless shelters here in Minneapolis say that they're pet friendly and pet inclusive, but it is still extremely limited. Beds aren't available. You might only be able to have one pet with you. So if you have 3 dogs, you have to make a decision of, do you want shelter or do you want to keep all your dogs? And we just have to stop sharing this because we know housing is so incredibly difficult to find a place with your pets. Now, a couple other tools. So making sure that we're using person-centered language. Our human services folks on the call, y'all know this like the back of your hand. It's language that puts people first. People are more than their disorders, their mental illnesses, their disabilities. It's all about creating the dignity, worth, and celebrating the unique qualities and strengths of every individual. This is a huge part of mutual aid. Again, it is everyone coming together to benefit the community. And so everyone is going to bring a little something else, regardless of what their situations are. We have to remember that everyone brings unique qualities to this work. This language, when we're working in and with community, It decreases stigmas, discrimination, misunderstandings, misconceptions, and the shame and guilt that oftentimes people feel when they're asking for support. I see this frequently. So people will show up to the resource center and you can just like their face kind of goes white and they feel really embarrassed about the fact that they need to ask for help. And then, they get to know us in that 5-10 minutes that they spent with us, and you just see their shoulders drop. You see the smile come back. You see the laughter, and they're like, oh, this isn't a place that's going to make me feel bad for not being able to afford to feed my pets. Like, you are truly a partner in this with us. Again, it increases that comfortability, provides opportunity for education and support. So if you have someone in front of you who maybe wants to volunteer, maybe needs support, maybe has something to give, if you make them feel like crap, they're not going to listen to anything else that you say. And so there's no opportunity to provide that education, that support that you're possibly able to give or willing to give, just isn't desired or wanted from that person any longer. The University of Minnesota has some amazing resources about deficit-based language and strength-based language. We hear a lot of deficit-based language within animal welfare, and I hear it sometimes in human services as well. But I feel like when you're working more on the human service end, you use more strength-based language, especially when you're working with program participants or community members. But in animal welfare, we use a lot of deficit-based language because we constantly are shaming pet owners for whatever their circumstances are, or always questioning, if they're worthy of services based on whatever deficits we think that they may or may not have. Animal Farm Foundation. So if you're thinking about doing a pet pantry, they have a new implementation guide that just came out. Feel free to check that out as well. So maybe you're a human service org and you want to have a little pet food pantry, or you're an animal welfare org and you want to partner with a human service agency to do this. Pet pantries are really, really hard work. It's definitely not a cakewalk. But I'm always happy to be a resource and have conversations about how we do our work. And this implementation guide is really great as well. Cuddly also has a guide for pet pantries. Yes, that is me and my dog Fern, right after we got her. And it features 2 pet pantries that are in Minneapolis, so us and the Bond Between. So it's nice to have 2 on various sides of the city, supporting people and pets. And this guide is also really helpful. It has also person-centered language. One thing for us specifically, we don't use the word clients. To me, that feels really clinical, and we really focus on community members. So going again back to that kind of mutual aid mindset of we are all one community, we're all working together. Whether you're here for services or you're here to volunteer or you have something to give. I mean, everyone that walks through your door has something to give, and they want to be a part of something. And so that's just really, really good to remember. Also, ableist language. So having, a lot of the deficit-based language on this sheet is very generational. I think that there are all words on this list that we have worked individually on removing from our vocabulary over the last, 10, 15 years. And so making sure that we're really using words that mean what we say versus some word that just kind of is an umbrella term, instead of saying, oh, people are insane, or that wasn't a really insane event that happened. We're really talking about like, hey, that was really intense, or it was really wicked. I don't know why wicked's on there, but I want to use it more in my day-to-day life. We also have the Adopters Welcome packet from Humane World for Animals. That's really great about removing barriers. Again, mutual aid is all about removing those barriers and making sure that we're supporting people. And Another thing that I think is really, really difficult. So when we go back to thinking about those beautiful pictures with the social media quotes, organizations all get lumped in together, regardless of if you're a shelter or you're a rescue. You could be a rescue doing really, really amazing things, but then the rescue down the street maybe has 30 dogs seized from them after there's a ton of news stories. It is really, really hard for the public to know the difference between organizations and the community. It's very similar in the human service world as well. Again, a lot of really great organizations doing amazing work. But if someone has a terrible experience at one, it's really hard for them to walk in the door for another one. So here in Minnesota, there's 469 registered rescue organizations in Minnesota. We know that there are more than that. Um, it's when you see a news story like this, it impacts everyone. Um, or having trying to tell the community that animal control is different than the Humane Society or any other rescue. Again, everything gets lumped in together. And so that's where it's really important that we're all doing really good work, that we are in community, we are, using person-centered language and making people feel like they have the dignity and respect when they walk in our doors. This is more about where people are getting pets. So we're in animal welfare, we continuously push people away. And I'm hoping that through, presentations like this, organizations can drop some of those barriers and really start welcoming in community to adopt. And with that, my email is there. Feel free to use it. But I am happy. We've got a little bit of time left. If there are questions that have populated in the chat, I'm happy to answer them.
Awesome. Well, first of all, thank you so much, Shannon, for such a wonderful presentation. We're so lucky to have you today. Um, like Shannon said, we are now in the Q&A portion of today's presentation. So please feel free to drop your questions in the chat if you have something that you would like us to read aloud to Shannon. We'll go ahead and get started with a few questions that came through during the presentation, Shannon. The first question we have is from Heather. Heather is wondering how using a mutual aid standard might impact grant funding. Do you have any thoughts on that?
Yeah, I it can be really difficult when grants have like there are some grants, especially in human services, right? Like families have to be under a certain income or they have to meet certain criteria. I think in general, it's really, really hard. As an organization, if there's a grant like that, we do our best to have a conversation with the grant funder um, and, try to change their mind or explain how we do our programming. And it would be really great if they want to support it. What I've also seen is grant funders removing those barriers more frequently and actually encouraging, especially in the animal welfare space, um, encouraging organizations to remove those policies and requiring it of the organization to, provide this food without um, income or any restrictions, which has been really fantastic.
That's great. Thank you so much for sharing that, Shannon. Question from Diane. Diane is wondering if some of the barriers that you outlined sort of earlier in your presentation were removed. So the example she used is meet and greets at animal shelters. A lot of animal shelters still require meet and greets. How can that shelter ensure safe adoptions, is Diane's question.
Yeah. So first off, I would check out the Adopters Welcome packet. There's a lot of really great science that um, Humane World for Animals and Maddie's Fund has done on this. When it comes, like at the end of the day, we need to trust people to make their own decisions in general in life, right? So not just when it comes to pets. When we're thinking about meet and greets, at least in this sense, what I think of is someone from the rescue going to the house, bringing a dog, and meeting their pets, but also that person in that situation is also judging everything else in that person's life, right? So, like, is there dust on the wall? Are there dirty dishes in the sink, right? So, we're having those conversations about like home checks as well and how non-dignifying that those can be for people. But I think that there are benefits in having animals meet to see if they're a good match, right? But that's why there's also these really great programming people called matchmakers in a lot of shelters and rescues across the country, having conversations with pet owners and seeing, based on what they're saying, what pet may be a good match for them.
That's great. Thanks, Shannon. And yes, definitely highly recommend checking out the Adopters Welcome resource that Shannon recommended. We have another question from Kathleen. So, on one of your slides, Shannon, you cited that 52% of American pet parents have skipped necessary vet care. Kathleen is wondering a great question, which is there any data on how many of those pet parents also skipped out on their own necessary medical care?
I, off the top of my head, and if someone knows this on the call, please throw it in the chat. I have not seen a dual study like that. I think something like that would be incredibly impactful. And I think that, when it comes to mutual aid and thinking about the services or even just community programming, right? Like it doesn't have to be this mutual aid model, but the work that we're doing in community. One thing that we try to do, so the city of Minneapolis has their own kind of mobile healthcare bus. And so we've invited them to be at all of our events, right? So if pets are getting the services that they need, we want to make sure that the humans can also get the services that they need or at least get connected to. Um, and so a lot of people would say that's more of the One Health type model, which is also a buzzword within our work in the human and animal well-being space. So really looking into more of the One Health type models would be really beneficial.
Absolutely. Thanks, Shannon. And I will just add, I also don't have any specific data available, but I will drop an article here in the chat actually about the One Health Clinic, which is based in Seattle, that provides veterinary care and human health care at their clinics. And this article talks a little bit about what they saw with some of their clientele, which was a 19% increase in follow-up care for the human participants in those clinics. And they also found that 85% of people who came originally to access veterinary care for themselves did opt in to receive healthcare for themselves. So great article, great organization based a little closer to my neck of the woods in Seattle.
And with that too, Danielle, like we do, so here at the Pet Resource Center, we're one of the most sought after social work internships here in the Twin Cities. And so we've had people walk in the door for pet food, and 6 months later they get a key to an apartment, right? So we are doing similar work, maybe not specifically doing the healthcare, but housing is healthcare. And so making sure that people have access to services for both ends of the leash once they walk in the door too. So it's also really important to do that.
That's great. Thank you, Shannon. And then Liv shared in the chat that she recalls hearing a statistic about how people are 3 times more likely to opt for veterinary care for their pets than medical care for themselves. So that's a very interesting statistic, Liv, and we'll be on the lookout for that to see if we can find a citation for that. Next question is from Dana. She is wondering if you know what percentage of housing rentals are pet friendly at all. And I'm guessing what she means by at all is in contrast to pet inclusive. So we
Yeah.
know that number for pet inclusive housing, but she's wondering if we have the number for rentals that provide any sort of pet friendly housing, even if it's not pet inclusive.
Yeah, we at my People's Family don't have that information. Michelson Found Animals and their Pet Inclusive Housing Initiative, they have a ton of research. They might be a good place to look at that. I mean, what we do know, I mean, of the 10,000 plus apartments that we have in our database, only less than 9% of them are dog inclusive. And so, um, regardless of if they accept a cat or, don't have breed restrictions, it's still just really important of, having those conversations that apartments need to be pet inclusive. We need to have conversations about the pet fees. Pet deposits need to be refundable. And just making sure that we're all advocating for that, whether you're an advocate for pets or people, or hopefully both, by the end of this conversation.
Awesome. Thank you, Shannon. Another question. So it sounds to me, Shannon, like building a mutual aid framework can feel a little bit overwhelming, probably for folks who are just getting started. So for those on the call today who might be interested in starting a mutual aid program in their own community, but they maybe aren't sure where to start, what would you recommend as a first step?
Um, for me, the first step that I like to tell people is you have to show up in community. So, right, like you have to go to community events. You need to meet who the community leaders are, what organizations already exist, kind of do um, a survey, an internal, I don't know, search of who is doing work in the community and how you can already partner with them. Um, the biggest thing with mutual aid, when we when we started back in December with Operation Metro Surge, there were so many conversations on Signal about we want to start this over here, but we're going to do the same thing 2 blocks away. And so my role in that was we have the space. Can everyone just come here? So we pool our resources and then we can support more people, because I guarantee this group, this mutual aid group over here, is supporting the same families that mutual aid group B is. And so if we can, all work together, that's really key. And so just getting to know your community, asking questions, and not assuming would be the first steps.
That's great. Thank you so much, Shannon. Well, we are just about at time for today, folks. And I don't see any other questions in the chat, but I will quickly read just a couple of comments here to close us out for today. The first one is from Liv, who says, Shannon, I love how you focus on care for both ends of the leash. That is such a powerful analogy for how we can explain One Healthcare to the public. And then a quote from Julia here. Julia says, I work in the farmed animal sanctuary space, which can and does intersect with shelter rescue work for companion animals. And I am working on a resource on mutual aid within the sanctuary community. I thank you for your work on this. It is much needed and much appreciated. So thank you so very much, Shannon, for joining us today. And thank you everyone on the call who was able to make it to today's webinar. We're so happy to have you here with us.